Hemorrhoids are some of the commonest gastrointestinal complaints of people who live in the developed world. Over 50% of people who live in the developed world will suffer from hemorrhoids at some time in their lifetimes. But as common as hemorrhoids are, their cause still has not been determined. Join me while we examine the causes of hemorrhoids. Mankind has struggled with hemorrhoids for millennia. Around 300 BCE, Hippocrates described the causes and treatment of the disease in his treatise on hemorrhoids. And in 37 CE, Aulio Cornelio Celso described hemorrhoids in the 7th book of De Medicina. Today, the cause of hemorrhoids continues to baffle scientists. They can only say with confidence what hemorrhoids are associated with. But what are these hemorrhoids that are so common? Our large bowels end in the rectum and the anal canal, and these structures are important in holding the stool in the bowel until we are ready to defecate. There are 3 cushions in the anal canal that are engorged with blood and that form a tight seal that prevents the leakage of bowel contents. These are the hemorrhoid plexuses, of which there are 2, an inner one known as the internal and an outer one known as the external. When these structures become enlarged and swollen and protrude from the anal canal, we refer to them as hemorrhoids. But in fact, every person has hemorrhoids, and the hemorrhoid plexuses are a normal part of our anatomy. But what causes hemorrhoids to enlarge and cause discomfort? Back in the day, physicians believed that hemorrhoids were varicose veins of the anal canal, but that has since been debunked. Today, the most popular explanation supposes that these cushions in the anal canal comprise not just blood vessels, but also muscles and connective tissue that fix the hemorrhoids to the bowel wall. During constipation, the hard stool prevents the drainage of blood from the hemorrhoid cushions, causing them to swell with blood. And when we strain, we pump even more blood into these structures, causing them to swell even more. This, along with the passing of hard stool, damages the connective tissue and the muscles holding the hemorrhoids in place and triggers an inflammatory response that leads to enlargement and growth of new blood vessels. The now loosened and enlarged hemorrhoids can slip out of the anal canal where they are sometimes seen. Because these cushions can no longer seal the anal canal, leakage of bowel contents can occur. That can irritate the area, leading to soiling, itching, and skin changes. If the straining and hard stool cause the hemorrhoids to erode, they can bleed. Bright red blood then appears on the surface of stool or may shoot out in jets around the toilet bowl. Usually, there is no pain unless it's the external hemorrhoid plexus that is inflamed or that has formed a clot. Why is it people in developing nations get hemorrhoids less often than people in developed ones? Anything that can cause constipation, hard stool, and straining is associated with hemorrhoids. Contrary to popular belief, being overweight, having multiple pregnancies, and living a sedentary lifestyle have not been associated with hemorrhoids according to recent studies. But diets that are low in fiber and straining to defecate have. Sitting on the toilet rather than squatting to defecate changes the anorectal angle, making it more difficult to defecate and causing straining. Lifting heavy weights, sitting for extended periods of time, and not drinking enough water and having hard stools can also put pressure on the hemorrhoids. People in many developing nations eat more fruit, vegetables, and legumes, squat when they defecate, and do not read books and cell phones while defecating. It is said that Napoleon Bonaparte's piles were troubling him during the Battle of Waterloo. maybe the battle could have been won with 30 grams of fiber. I hope you enjoyed the video. If you did, like and share the video with friends and family. Leave your comments in the box below, and don't forget to subscribe to the channel to support the channel. Until we meet again, stay healthy and stay safe.